Hello, everyone. Let's talk about offering reassurance is a very important part of clinical communication skills. And reassurance has many benefits, but maybe I would say it helps to decrease patients' anxiety, stress, and fear. And it also helps to reduce uncertainty and build trust between you and your patients. So please always reassure your patients. Right. So just let's give you some few examples to help you reassuring your patients. Well, so you can say it's natural to feel anxious about the procedure. I will be by your side throughout to provide comfort and reassurance. Well, so I think as a general rule in clinical communication skills, you need just to acknowledge the feeling, the emotions, and then you need to say, I'm here. Yes, I know that you are afraid. I know that you distressed, and I'm here for you. So this is any sentence you use, it has to have these two parts. Acknowledge the feeling, the emotions, and tell them that you here for them. So, and if you see all the sentences, you'll find the same. Like we start with acknowledging the emotion and then say that we are here to support you. So it's natural to feel anxious about the procedure. I will be by your side throughout. Of course, you have the chance to use whatever you want, customize your own sentences. It's just this is few examples for you. Also, you can say, I understand that you are feeling worried. I understand that you are feeling worried, and I'm here to support you through this process. Also, you can say it's completely normal to feel anxious. It's completely normal to feel anxious before the surgery. And we will take care of you and monitor you closely throughout the process and deal with any problem as they arise. So say whatever you want to say. And also you can say it's nothing to be alarmed about. It's nothing to be alarmed about. It's just a routine check. And this is really very, very important sentence you have to use in when taking, for example, history for your patients. Some patients get alarmed by the load of the question you ask them. And for example, if you ask them, do you have any family history of cancer? Their eyes will be big and just will be very scared. So always tell them it's nothing to be alarmed about. It's just a routine checklist. I ask all the patients about them. So always signpost before you ask any question that might cause worry to the patient. So just signpost and say, I'm asking this question because it's part of a routine check. It's part of the procedure I'm doing. It's just a checklist we do for everyone. So don't scare your patient, please. And also, you can say there is really nothing to be worried about. It's a standard procedure. Same way, there is really nothing to be worried about, or it's nothing to be worried about. This is good phrase to use to start your sentence with. It's nothing to be alarmed about. There is really nothing to be worried about. Same. So another way, also like when I call my patients' relatives, I start with this sentence. Because, for example, if you want to update someone over the phone regarding their parents, for example, who are in the hospital, just before you start talking to them, when you introduce yourself, they will start to panic. So please, after identifying, like checking the ID, just tell them there is nothing to be worried about. I'm just calling to give you an update about your father. Okay? So it's nothing to be worried about. I'm just calling to give you an update about your father. And also you can say, I understand that you are worried about the procedure, but we have a highly skilled team here. But we have a highly skilled team here, and we will take excellent care of you. So especially when it comes to surgery, the patients want to know the surgeon that are going to do the operation is a highly skilled one. So it sometimes could be appropriate just to point out this point and tell them the team we have here is highly skilled teams and will take excellent care of you. Thank you so much. This is few examples. There is plenty of them, and the most important part of this presentation and the message to take home, please always remember to reassure your patients to reduce their stress and never leave them uncertain, scared when you say bye to them. Always make sure you give them some kind of reassurance. And of course, you have to be honest with your patients, but being honest doesn't mean to scare them. You can always talk more about the positive side of their illness and what you can offer them rather than talking about what you can't offer them. Thank you so much. See you another time with another topic in clinical communication skills. Keep practicing. Have a good day. Bye bye.